Dr. Jones, who is one of our sports medicine physicians here at Scottish Rite, takes care of musculoskeletal conditions, concussion, but I would say one of his unique talents is utility of the ultrasound. He's a whiz. He does phenomenal, both diagnostic and injection, has been instrumental in really advancing our care of the youth athlete. So, Dr. Jones.
And thanks for coming out this morning. We're going to talk a little bit about some common injuries and less common sports. So these are some of the objectives that we're going to review and hope to fulfill this morning. So this is the sequel to part one. You guys may have seen Top Gun. It was a good movie, right? And recently, the sequel came out, and a lot of people said it was better, which is hard to do for a sequel. Some people even said it was absolutely terrific in every conceivable way. No promises that this talk will be like that, but I will promise that this talk will not be like The Land Before Time. I remember when I watched this as a kid, it had 13 sequels. There will not be 13 sequels to this talk, all right? All right, so these are the big five sports here. You got soccer, football, basketball, baseball, and volleyball. They're the big five in our clinic because those are the athletes that we see most often. But we're going to cover other sports besides those, all right? Those big five sports consist of about 2/3 of the athletes we see. But then there's a whole lot of other sports, greater than 1/3 that we see here at Scottish Rite. And these less common sports, you can see this graph is kind of the number of patients we see who identify these sports as their primary sport has increased year to year. So these less common sports continue to grow in popularity. And then this is a national survey, so this kind of gives you an idea nationally of the sports that they're the primary sport that's played by youth athletes here. All right, so here's the sports that we're going to cover today. So first, we're going to start off with softball. All right, so a little bit about some softball injuries. Injuries are most often seen in pitchers, and the shoulder is the most common location. And there's been a study that showed that that shoulder is most likely getting injured within the first 6 weeks of a softball season. And similar to baseball injuries, there's an association between pitch counts and shoulder pain or shoulder injuries. All right. Other common injuries that we see in softball, besides shoulder-type injuries, ankle sprains, concussions are also somewhat common. So how does this differ from baseball injuries? Well, we see a whole lot more elbow injuries in baseball players compared to softball players. And most of the elbow injuries in baseball are from pitching, whereas the elbow injuries that we see in softball, not very often that they're actually seen from pitching. So in baseball players, if someone has shoulder pain, a Little League athlete, a lot of people say, hey, they probably have Little League shoulder, right? Kind of got that name association. Little League athlete, Little League baseball player with shoulder pain probably has Little League shoulder. Well, we do see this in baseball players, and we know it's mostly because the amount they throw, and the reason why it happens in them is because of their mechanics. If you look at how this young baseball player is throwing, you can see the torsional stress that places on the shoulder. Whereas if you look at the softball pitcher there, they don't have those same stresses placed on the shoulder. And so it's not likely that softball athletes are going to get Little League shoulder, which is an overuse injury of that proximal growth plates in the proximal humerus, all right? So just because a softball pitcher or a softball athlete has shoulder pain and they're Little League age doesn't mean that they have Little League shoulder there. All right, we're going to give some advice from an expert. So this is Katie Holhouse. She's a physical therapist and certified strength and conditioning specialist here at Scottish Rite. So she has a lot of experience with softball. She played softball during youth, all the way into college, even got a college scholarship to play at George Mason University, and she even coached high school softball. So her advice is that most injuries are overuse. So make sure that you take a break throughout the year. And an appropriate warm-up should include body movement of all joints, all right, not just the shoulder there. And whenever you're doing strength and conditioning for a shoulder or for a softball player, make sure you're focusing not only on the upper extremity but also on the lower extremity there. All right, so now we're going to move into our next sport, which is tennis. So some unique aspects of tennis, unique movements, right? Running, cutting, pivoting, some jumping. Combine that with upper extremity hitting. We're going to do a lot of rotation and upper extremity movements as well. So can play it on different surfaces. It's an individual sport. Exception is for doubles. Yes, there are teams, and how you do can affect your team, but you're playing one-on-one or two-on-two there. And there's no time limits. So some of these tennis games can be really, really quick, and some of them can be really, really long. So those are some things to keep in mind with tennis. So what do you think is the most common site of injury in a tennis player? Any thoughts? So ankles, yeah, those are pretty common. So yeah, ankle sprains. According to the study we looked, shoulder is the most common site, right? You're doing a lot of swinging, a lot of serving there. Number 2, the lumbar spine, kind of all the extension and rotation you're doing in your core. And then the knee on there. So the most common mechanism from this is just the repetitive external rotation that you get in the shoulder whenever you're hitting over and over and over again, all right? And then the overextension of the spine with serving and hitting. All right, so we get this question a lot, right? People know there's a name association with an elbow condition. It's called tennis elbow. But do young athletes get tennis elbow? So if their elbow hurts and they're young, do you say, hey, they have tennis elbow? Well, it's not as likely. Well, why is that? Well, it has to do with the anatomy, right? The growing athlete has a different elbow than the adult athlete because they have a lot of growing centers or growth plates, which are oftentimes more susceptible to injury than the adult elbow. So here's just a schematic or an image there of the different growing areas of the youth athlete elbow. Whereas the adult, right, they don't have any growing areas because they're finished growing. And so their elbows, specifically the tendons in their elbows, may be a little bit more susceptible to injury. And that's what tennis elbow is it's tendinitis of the lateral elbow, okay? So youth athletes, if they have elbow pain, probably not tennis elbow, even though they are tennis players, okay? So what's some advice from an expert? So this is Dr. Arvidsson here. If you don't know about Dr. Arvidsson, he knows tennis, and he's really good at tennis. So he was a 3-time Texas high school state champion in tennis. He went on to play tennis at Baylor and was a Big 12 champion twice. So he says that a dynamic warm-up is key for injury prevention, and many of the injuries that we see in tennis players are from faulty mechanics. So make mechanics an important part of tennis training and tennis practice, all right? And then there's a program called the Throwers 10, which is a specific strengthening and rehab program that we use a lot in throwers, but you can translate that into tennis players, and it's a good supplement to the serve to help improve their mechanics and their strength and help prevent injury as well. And he also says, remember, good hydration, especially in the summertime. Remember, these tennis matches aren't timed, so they can go on a long time, so make sure these young athletes are practicing good hydration there. All right, now we're gonna move on to martial arts. So a couple unique aspects of martial arts. It can build strength, balance, increase flexibility. There's also some other benefits that a lot of people like, including improved cognitive function, self-esteem, self-respect, self-awareness. There are different types or different forms of martial arts. So what are the different types of martial arts? So there's striking, so think Taekwondo, that's when you're on your feet to defend yourself from the opponent. There's grappling types where you're working to take the opponent to the ground. Those would be like judo or jiu-jitsu. There's weapon-based forms of martial arts. So what weapons are they? Just think of the Ninja Turtles and the different weapons they used. Those are the weapons that they use in the weapons form of martial arts. And then there's low impact or meditative styles. So Tai Chi, where it's more of kind of these movements and not really combative, just kind of doing these movements and getting some meditation in with these low impact movements going on. All right. So what are some of the injuries that we see in these youth competitive karate athletes? Any guesses to the number one location for injuries in a youth karate athlete? Yeah, making you guys think, you haven't thought about this before. Well, the head is the number one location. Number two location? Any thoughts? It's actually the pelvis. How about the top injury type? What's the most common injury that we see in youth karate athletes? Contusion. We do see concussions, though. The second injury type is actually a bloody nose there. So here's a group of our athletic trainers here at Scottish Rite. They have a wealth of experience covering lots of different events. So they have more than 50 years of experience at all participation levels, youth athletes through high school, through college, through professional, right? And so when a youth athlete or even adult athlete has a bloody nose, they're not allowed to continue to participate until that gets taken care of, right? And so these bloody noses are going straight to the athletic trainers so they can get taken care of quickly and appropriately so that the athlete can continue to participate. So what advice do all these great athletic trainers have about bloody noses here? The number one advice that they all said is do not tilt your head back, okay? So what happens if you're bloody nose? It may be natural, like, oh, we don't want it to bleed out, tilt your head back. Then they're going to swallow the blood, and that's not going to sit well in their stomach, and then they're going to start vomiting the blood, right? So it's better to just lean your head forward so that, yeah, you can apply some pressure. It's going to bleed out a little bit, but that's okay. That's more preferable than having them swallow the blood. And then there are different things you can use, little nose plugs, or you can cut off tampons and put those in the nose to help apply some tamponade, to help apply some pressure there to help stop the bleeding as well. All right, and always keep gloves, gauze, Vaseline on hand. Now, when bloody noses occur, they most common occur at what's called Kisselbeck's plexus, and you can see that circled there on the schematic. So just inside the nair, just on the medial side. So if you're going to apply pressure, make sure you're applying pressure to that side. And if someone gets frequent bloody noses, you can apply a little bit of Vaseline right in that same spot as well, and that may help with prevention with prevention of bloody noses. All right, now we're going to move on to another sport. Now we're going to move on to rugby. So what are some unique aspects of rugby? Well, by some sport sources, it's the 9th most popular sport in the world. Definitely not the 9th most popular sport in the United States, but it is growing in popularity in the United States here. So youth follow different rules than adults. So they follow this thing called a progression of play. Some people call it mini rugby. So when they're first starting out, there's actually not even any contact. And then as they progress, they don't have all the same aspects of rugby. They've eliminated some of the aspects that have higher injury risk, okay? And so as you grow and mature and learn the game, you eventually gradually get into kind of full adult rugby, okay? But youth do not start out like that. All right, so let's talk a little about the injuries that we see. So injuries most commonly occur in a match. And more than 3/4 of the injuries occur during tackling. So tackling should be a focus of injury prevention there. So the highest injury incidence age group is in teenage females. All right, so just be aware of that. Most common location for injuries. Anyone want to guess on what you think in rugby is the most common location for injuries? I see some people pointing to their head a little bit. The head is the most common location for injuries. The most common type of injury. So, according to one study, joint injury, so just any injury to the joint, and contusion are the top two, so that would probably be like joint sprains or joint strains. Concussion was the third most common, and then fracture is listed as the fifth most common according to this study that I read here. So here's some advice from an expert. This is Ray. He's one of our certified pediatric nurse practitioners in our fracture clinic here at Scottish Rite. So he's been here for a while, and he knows fractures really well, and he knows rugby really well because he played college rugby, kind of played throughout his youth and into college. He's been in rugby as a player, and now he coaches for more than 20 years, so he knows rugby well. So what advice does he give? So he says tackling form is key to avoid head injury, which goes in line with what the study said. So when he teaches tackling, he says that the proper form is when you tackle, your head goes to the side of the hip. The term that the coaches and the players use is when you tackle, you go cheek to cheek. Okay, so that's kind of the common term that you'll hear out there. He also said, understanding and following the rules will not only prevent injuries, but it will prevent penalties as well, right? It's a little different from football. People think it's football where you can just go and plow somebody over. That's a penalty and you get thrown out of the game. When you tackle, you have to tackle a certain way, and that will not only prevent a penalty, but it will prevent you from getting injured. So here's a picture of proper tackling form. So they go, and you have to wrap up. You can see how the tackler's head is just to the side of the hip of the runner there. So just one note on rib injuries here. So remember, in rugby, there's no protective gear like there is in football. And so what do we know about rib injuries in kids? Well, rib fractures are less common in kids compared to adults, okay? But when kids do get rib fractures, they're more likely to have some secondary injuries to their internal organs that the ribs are protecting, okay? So if you're covering an event or someone comes in and they have a rib injury, these are some of the red flags to be aware of, that there could be something more going on than just a rib injury. So just beware. These red flags, if you're at an event, these people need immediate medical attention. All right, now we're going to move on to fencing. So a couple unique aspects of fencing. It's a combat sport that involves sword fighting. There are actually 3 different disciplines of fencing, and most competitive fencers will specialize in just one of the 3. There's one called foil, that's pronounced épée, and then there's saber, okay? Each has different weapons that they use, different targets that they can target on their component, and different rules involved. So if youth are going to be involved in this, they need to know the rules, and it's good to know the differences if you're providing medical coverage for these athletes here. So these are the different weapons here. You can see there are different hands, different sizes, different grips, and different sizes to the different weapons. And then these are the targets that they can hit whenever they are doing the fighting. So let's talk a little bit about fencing injuries that we see. So the highest injury rate is in the saber discipline there. And in all fencing injuries, the areas of highest injury is the knee, then the thigh, then the ankle. So you can see that picture there of that fencer who's lunging. If you look at that lead leg, that lead knee, you can imagine if they're doing that over and over and over again, you can imagine that stress that it will place on that knee. Now, from the fencers that I've seen, anecdotally, I see more injuries in that lead leg, and that makes sense with kind of what we see and how the sport goes. So, common acute injuries that we see in fencers, according to the studies, most likely sprains and strains there, so kind of lower key ones. What about common chronic injuries? Well, the most common is patellofemoral type syndromes, right? That lead leg, as they're lunging, that pressure over and over and over again can lead to some pain on that knee joint there. So what is a unique injury or unique aspect to fencing there? Well, in fencing, you can get puncture injuries, which you don't often see in other sports. But the good news is if you use proper equipment for fencing, the overall rate of injury, including puncture injuries, is very, very low, one of the lowest, okay? So our job is to make sure that proper protective equipment is used. And if you're covering these events or providing any type of oversight to these events, just be prepared to address any puncture injuries that may occur. And it's a growing sport, and it's both an Olympic and it's also a Paralympic sport. So that's kind of aiding or helping with its growth a little bit there. All right, now we're going to move on to track and field. So unique demands of track and field. So there's lots of different events, right? Running, throwing, sprinting, jumping, and then some of the events have a combination of all of those different activities in them. So there's obviously different injury patterns based upon each event within track and field. So if you're providing any type of coverage or any type of oversight for track and field, it's more than just watch the pole vault fit. So I provided coverage to, I think it was the 2019 NCAA Division III Indoor Track and Field National Championships. And so they said, hey, just sit by the pole vault pit. That's where all the bad stuff happens, right? If it's going to happen, it's going to happen there. So I'm sitting there, and then right next to us was the hurdle sprint event. And so they just kind of fire the gun and they shoot, or they shoot all the blocks, and then all of a sudden there's screaming and wailing, and I look over and there's athletes just laying on the track. And what had happened is as two athletes hurdled over, one hit the hurdle and caused him to lose balance, and then he spiked the athlete next to him and caused a big laceration on his knee. And so we had to take him back and sew him up a little bit. So if you're covering track and field, there's more than just the pole vault pit, okay? So let's talk a little bit about hurdles. We actually did a study here at Scottish Rite with some of our partners across the country where we looked at hurdle injuries and youth hurdlers. So we learned that the top 3 injured body parts were number 1, the ankle, number 2, the knee, and number 3, the wrist. And what were the top 3 injuries that went to the emergency room? Well, fractures were most common seen in the emergency room, then joint sprains, and then contusions there. And then we looked at the differences between male injuries and male hurdlers and female hurdlers. So we saw that males had more fractures than females did, and females had more joint sprains and more contusions than males did. And then what about injury location? Well, we saw females were more likely to injure their ankle, while males were more likely to injure their wrist. And then we looked at younger hurdlers, so pre-high school versus high school hurdlers for both genders here. And we saw that younger hurdlers were more likely to have fractures compared to older hurdlers. And then older ones were more likely to have joint sprains. But there were no differences in the actual locations between younger and older hurdlers there. So here at Scottish Rite, we're always trying to learn how to better, we're always doing some research on different youth athletes, and one that we're doing currently is on youth runners. And so we're using the help of our movement science partners here at Scottish Rite, where we get these youth runners and we hook them up to these different probes, these different markers, like you can see here and see here. And what it does is they run through, and there's these specialized cameras that really kind of turn these athletes into more or less a video game so that we can get all these different measurements on it. You can see on the computer screen what we look at and what we're able to measure there. And so we did a little pilot to make sure that this research project is going to go well and obtain what we think we can obtain from it. So here's a video of us with a bunch of runners. You can see they're running through our lab, and we're assessing all different types of things on them because they have those markers, we have those cameras, we have these different pressure plates in the floor as well. So we can measure all types of pressures and strengths and movement patterns and angles and all these things. So we're trying to recruit some more runners to study this more. So if you know any youth distance runners, you can contact Alex here, and we'd love to have them participate in our study as we try to learn more about youth runners so we can better treat them and better prevent injuries in them. All right, here's just a couple of my references. Sure appreciate your attention. Open for any questions you all may have.
All right, Dr. Jones, that was great. Really appreciate the talk. A couple questions coming in from online. First, anybody here have anything specific they wanted to know more about or questions on anything that Dr. Jones mentioned? Any takers? No? Okay. Well, a couple of the questions that came in, you mentioned a lot dynamic warm-ups and the role they play in preventing injuries. Can you or any of our therapists or ATCs out there kind of give us an example what that means, maybe some specific resources to go to for somebody that's maybe coaching a team or kind of dealing with youth athletes? They're coming in asking questions in the office.
Yeah, so dynamic kind of full body movement is important. So making sure they're moving and they're moving kind of all of their joints. So the PTs or ATCs may be better to speak at this, but the principles I'd recommend is start with kind of getting those muscles warm, right? Kind of getting your blood flowing, and then moving all your joints in all the different directions, right? And so kind of sport specific, you can gear that towards the sport that they're about to participate in. But just because, softball, even if you're playing right field and not going to get much action out in right field, warming up both the lower extremity and the upper extremity, even though you may not actually make many throws during the game.
Got it. Anybody else, any therapists, athletic trainers out there that have a suggestion on resources to send somebody to? Perfect. All right.
I was just going to, we know with soccer there's the FIFA 11, is that what they're calling it now? FIFA 11 plus. Is there anything like that for any of these other less common sports? Has anyone developed anything like that?
I'll let some of you, our sports guys, kind of talk about this. I think that I have seen that seems to be adapted quite a bit to use across multiple different sports is kind of the feel I get with that. But Dr. Jones or Dr. Miller, Dr. Wilson, anybody else have a comment on that?
Yeah, I mean, you probably know this already, but soccer, especially female soccer athletes, have high risk of ACL injuries. And so I think a lot of impetus for getting that developed was to help prevent that. And, obviously that's a kind of a detrimental injury we see in sports. So trying to kind of transition that to other sports makes sense. I don't know that there's been the level of research on warm-ups for other sports, but I can, if my colleagues here want to answer or address other specific sports that maybe where they've seen similar type activities or warm-ups done.
I just know that one of the advantages of that was it's designed to teach the coaches how to incorporate that into the warm-up. So just kind of, I would think that with these other sports, that would be important that the coach is the one that's incorporating these dynamic warm-ups, in. So I was just wondering if they had taken that any further. And I have one other question about softball pitch counts. I'm less familiar with that. So are they being as strict about that as they are with baseball?
It's a good question. I know there are recommendations for pitch counts out there, and I know I don't see, anecdotally, I don't see as many softball injuries or softball pitchers in clinic with upper extremity issues compared to the baseball pitchers. So there's probably either they're being much better at it, or the kind of like we saw, the risk of injury to it is a lot lower. So even if with those pitch counts, you're not as dealing with as much of the consequences of it as you do in baseball. So
I see a lot of low back pain with the softball pitchers, like if they're, just that repetitive extension.
yeah, kind of really rearing back to try to put some heat on it over and over again.
Dr. Miller, we'll get a mic over to you real quick. Got it, Brandy?
Thanks. As you mentioned, we see a lot of the common sports, and a lot of us have either played or coached or watched on TV some of those big ones, and probably familiar with some of the terminology. And but as we start to care for young athletes who are playing sports that maybe we are not as familiar with, especially if it's something earlier in our career or we haven't had as much experience with. So, for example, when I moved here, I hadn't cared for a lot of gymnasts. But do you have any advice for maybe caring for an athlete that you are not as familiar with their sport yet, and how you might approach that differently than somebody who plays basketball or soccer or something that you see frequently?
Yeah, I think it creates some type of a good connection, and it demonstrates humility to ask them about their sport. Don't try to fake it and pretend that you know everything about it. Just ask them about that and learn, and that can create a connection, and then they can come back and see you. You can continue to learn and learn and learn. If you're in an appropriate environment, you can ask your colleagues around here. For example, Ray, one of our fracture clinic providers, knows a lot about rugby, right? Because he played it. I don't know a lot about rugby, but I've talked to him a few times now throughout the couple years I've been here to learn more and more about rugby. So rely on the people around you who have experience or have a little bit of knowledge about this sport. And say, in multidisciplinary care settings, if hey, I'm seeing this softball player, I know this physical therapist, she was a softball player, she likes working with softball players, then it's a good connection, a good referral that you can make over to that physical therapist or that ATC for kind of multidisciplinary care.
I was going to say, I treated a young fencer, a few years back. I knew nothing about fencing, so I'm like, bring your stuff in to the clinic, and she brought her stuff in. And it was so fun because I knew nothing about it. So, but what was interesting is she, I think she was probably like a freshman in high school, and very competitive, and she had wrist pain, and she brought in her, I can't remember which one it was, her sword, and it was, controlling that long lever arm, and she was having wrist pain, but it was because her scapula, she didn't have the scapular strength. But I never would have known that if she hadn't brought that in, we hadn't, teased that out a little bit. So we focused a lot of scapular strength with her, but anyway, it was fun for her to bring her equipment in and to show us and stuff.
Yeah, that's a great idea. Yeah, have them demonstrate. If nothing makes sense what they're telling you, just demonstrate it to me. Bring in your things to show me. That's a great thought.
I was gonna say, I grew up doing gymnastics, so if y'all have questions about their practices or anything, I can help with that as well.
Yeah, certainly. There's certain sports like gymnastics and others where it's almost a different language, right? They talk. The young gymnasts say, oh, I did this and this and this, or it hurts whenever I do this specific thing as part of my routine. You got to know what that means, right, to know how to address it and help it.
So since you mentioned rugby, there's another one coming in online on rugby. So in football, we focus a lot on the helmet, and year after year, they have the latest and greatest technology in the model that comes out Rugby, they don't really wear a helmet per se. Do you have any idea of the number and the correlation of concussions in football versus rugby?
Yeah, it's actually significantly lower in rugby compared to football. So we see that both in the United States and kind of across the world there. I think a lot of it has to, so we've learned that concussion or helmets, I mean, they prevent skull fractures. They probably don't do a great job at preventing concussions because we still see a lot of concussions in football, but we don't see as many in rugby. So it's more about kind of the rules and the using proper form with that, right? In football, there's a few rules in regards to tackling, like you can't grab them around the neck, like you can't grab their face mask. In rugby, they're a lot more strict on how you tackle, right? And so you have to tackle a certain way, and it ends up preventing concussions and other injuries. So.
Next question online is any recommendations on injury prevention for hurdles specifically?
Yeah, I think the general principle would still be kind of good dynamic warm-up, right? That's going to help prevent a lot of the chronic issues. The other issue is, the unique thing about hurdles is you're combining running, sprinting, and you're jumping over an object, and you got to be the fastest at it if you want to win, right? And so it kind of incorporates all these unique aspects to it. So one, I would say dynamic warm-up, working on that can help both acute and chronic type injuries. And then two would be, working on form and practicing your form and kind of they talk about steps in hurdles so that you take a certain amount of steps and you kind of do that over and over again, which helps with your form so that you don't clip the hurdle, your steps a bit mixed up, and then you miss jump, and then you collide with the hurdle, and then you affect the other people around you and all those things. So dynamic warm-up and form and mechanics, I think, would be key. And obviously, in youth hurdles, it's the younger you are, the shorter the hurdles are, right? And then it kind of advances up as you get older. So making sure you're good with the smaller hurdles, and then gradually get up to kind of your regulation size hurdles, I think would also be important. Don't go into the normal full-size hurdles right off the bat.
All right, this is my question. We live in an area where we don't really have average athletes. Everybody's elite, right? They're all elite. Everybody's kid's elite. So all these families are looking for advantages. What advantage can you get? What recovery advantage? Any advantage you can find. So I get a lot of the question of cryotherapy in our kids. I'm sure you get the same. I'd love to know how you answer that, though.
So, the true scientific answer is there's not a lot of great scientific evidence out there that cryotherapy has a lot of benefit to kids. And so what I typically will say, okay, what's the purpose of cryotherapy? Or what do you feel is the purpose of cryotherapy? And it's like, well, it kind of cools them, it helps with their muscles. And so I talk about, will ice do the same amount, the same job on a more targeted area? But you have to understand a little bit. The flip side of it is, as a medical provider, our number one goal is to do no harm. And so I always say, well, there's no hard scientific evidence that it provides a lot of benefit, but there's also not a lot of scientific evidence that it appears to cause harm, okay, if used properly. So I'll say that as well. It's like, well, it probably doesn't cause harm, but you probably are getting just the same benefit from using other things, and it may save some money. So obviously let them make the ultimate decision, and just kind of give my advice from what I know, which there's not a lot known out there in regards to kids. So.
Anybody else have any thoughts or anything to add on that? Okay. Another question coming in would be on overuse injuries in general. When do you recommend your athletes actually take forced rest from an overuse injury or a suspected overuse injury? When do you pull them out?
So for an overuse injury, a lot of it depends. We see lots of overuse injuries, and Some of them, you need to force rest, and some of them, based upon circumstances, it's okay if they continue to participate. So there's lots of different factors as far as location of injury, what the actual overuse injury is, what sport they play, how long they're going to be playing it. We have a little bit more, we usually provide a little bit more general guidance as far as preventing overuse injuries. And that is, the AAP, American Academy of Pediatrics, has come out with statements regarding overuse injuries and sport specialization. And their general recommendation is taking 3 months off per every 12 months for every year from a specific injury. And that can help prevent overuse injuries. It can help prevent burnouts. It can help prevent sport specialization, which leads to overuse injuries and burnout. So hard, kind of injury specific, sport specific for the specific overuse injury, but general recommendations for, we can provide more general recommendations for preventing overuse injuries.
All right, somebody out there is wanting to jump to part 3 of this talk. So would the injuries associated with badminton and racquetball, would you assume that they're going to be similar to other, like tennis, other sports with the same type of mechanics?
Probably. I'm curious. I wonder if you'd see a little bit more wrist type injuries in racquetball and badminton and maybe even pickleball. So that's what the craze of pickleball in there. So.
Anybody else out here have any questions? Perfect. Get this to you real quick.
So I was a collegiate gymnast, and so with the rise of the sport in our area specifically, there's a lot of programs in the DFW area. What is the most common injury you see with that population?
With the gymnast population specifically? Most common, it's probably going to be between, we see, they over-rotate or misland. Ankle sprains is probably the most common kind of acute type injury for it. As far as chronic type injury, wrist pain leading to gymnast wrists, which kind of the distal radius, the growth plate there, just from the repetitive impact on that wrist over and over and over again can affect that growth plate a little bit. Another common one, common chronic one would be dorsal ankle impingement. So landing, especially if they land short, over and over and over again, can kind of impinge the tissues between the talus and tibia. And you oftentimes get subsequent or associated Achilles tendonitis, so kind of the back side of the heel. So kind of stresses on the back side and stresses on the anterior side. So that would be, just thinking right now, those are probably the most common things that I see in the gymnasts. I also see a lot of back issues from the repetitive extension. So stress fractures in the back, spondylolysis would be another really common one we see in the gymnast. So.
And just kind of piggybacking off of that question and then the previous one, those gymnasts that come in, they're right in the middle of their competitive season. They've been diagnosed with a stress fracture, and the parents there and they've invested all this money, and you're having to have that hard conversation about you have to rest. And that's one of the things that I appreciate about the doctors here, is that if just the way they communicate with the therapist is so helpful, because if the parent especially and the patient is hearing the same thing from all of us, it's so helpful to have those conversations. So I always appreciate just the feedback and the communication from the doctors here, because it's helpful when you're having those conversations.
That's right. That's a great comment. Care, the importance of care, or the best care for the child is multidisciplinary care, especially in these unique circumstances. And the other kind of value or principle you highlighted on is the idea of joint decision making, right? And so oftentimes these young athletes and their parents may end up doing what they're going to do regardless of what you say, but if you and the other players on the care team are on the same page and present that to the young athlete and their parents, it can certainly help them make maybe the best decision based upon their interests. So.
I was just going to say, I completely agree with you, and I think that applies to all of the patients and all of the injuries that we see and share, whether it's the athletic trainers, physical therapists. That open line of communication makes for better care for the athlete. And so I think I can speak for all of us here at Scottish Rite, provider-wise. We love it. And if you guys are seeing patients that you want to reach out, make sure we're on the same page, or because you spend way more time with them than we do frequently. You see them much more often, and you get to spend a lot of time with them. You pick up on things, and so we are always open to that phone call, that email, reach out to us, and vice versa. And we very much enjoy, I think, collaborating and working with you guys, and the patients really, truly benefit from that. So thank you, Amy, and your group for continuing to do that as well.
Great. One last comment. If you're interested in learning more about MSK ultrasound, we're having a hands-on course in about a month. So get to practice real-time ultrasound. There's just a few seats left. So if you're interested, please join us. We just got PT credit, so if physical therapists are interested in learning it, you can get some PT credit for it as well.
Great job, and thank you. Appreciate it. Looking forward to part 3. Go ahead and get started.